G'day everyone, welcome back to the channel. So in today's video, I want to talk to you guys about why tennis elbow is very likely to be neck related for a lot of people. And I certainly appreciate that that statement can sound a bit strange and far-fetched because it's a little bit different to what we sort of spruik out in the industry at the moment. But from what I'm finding clinically, there's a very strong, tangible, reproducible link between subtle neck dysfunction and the elbow. So particularly in terms of what causes tennis elbow. So hopefully I can get to that in the video. And then towards the end of the video, I want to take you guys through two really simple exercises that work really well to try and sort of decrease some of that hidden dysfunction that you may not be targeting if you do have tennis elbow. And these exercises go beyond the stereotypical treatment for tennis elbow or lateral epicondylitis, like your eccentric strength programs, which are really important. Your wrist and forearm stretches, taping, dry needling, whatever it is that you're doing that's very local, that's very elbow specific. These two exercises are hopefully going to sort of piggyback onto the back of that and hopefully make that stuff more effective, because we're potentially getting to some hidden underlying causative factors of why that stuff's there in the first place. So before we get into it, obviously, please let me know down in the comments below how your tennis elbow is going. How long have you had it for? How are you holding up mentally? Are you frustrated? Are you just at the start of that journey and hoping that it goes away quickly? Or are you someone who's been going through this now for a number of years and you're just looking for something different? And if you do go on to enjoy the video, please let me know. But also, if you could leave a like on the video if you find it helpful, and consider subscribing to the channel if you really enjoy this kind of information. And hopefully this video sort of speaks to the content that we've already put out in terms of I guess trying to give you guys a new perspective or a broader perspective on some of the really common aches and pains that we deal with. A lot of the conversations that I have clinically about trying to solve people's dysfunction are really the catalyst for the ideas behind the video. So hopefully if you're into that sort of stuff, you can follow along and join the channel as well. With that being said, so what we want to talk about in terms of this tennis elbow dysfunction relating to neck dysfunction, it's sort of bred from an idea that has never really sat well with me as a physical therapist / physiotherapist, is that we put tennis elbow into the box of overuse injuries or repetitive strain injuries. And if you've been following the channel, you'll know that we did a video a couple of months ago talking about repetitive strain injuries and how the neck and upper back dysfunction sets those tissues up for failure. And again, we want to tease those ideas out today and make it specific to tennis elbow. But one of the problems that I have with our thinking is that there's two ideas here that butt heads and don't necessarily make a lot of sense. There's a missing piece to this puzzle. So the first is that we look at overuse and repetitive things as giving us the potential for dysfunction, in that if you do something too much, you overuse that tissue and you can set it up for failure long term. But use and repetition are literally the things that our body are designed for, particularly our upper limbs, our hands, fingers, wrists, and forearms are literally designed to be used ad nauseum to achieve tasks day to day. And not only that, but we look to repetition and use as ways to acquire strength, endurance, skills, particularly new skills, and skill mastery. We look to thousands and thousands of repetitions to rewire our nervous system, to develop the motor patterns and the control, the strength and fitness in order to achieve the things that we value day to day. Yet at the same time, we're saying those very things that you're doing in a positive sense, that are these adaptive things that the body goes through, are the very same things that potentially will cause you injury if you do it too much, whatever that is. And this never really sat well with me, because looking into those issues further, when we're looking at the dysfunctional side of things, there's often some hidden, covert, mechanical dysfunction that we take into those moments that set those tissues up for fail. So it's not that use and repetition potentially cause issues, it's that use and repetition of a mechanically dysfunctional area can potentially cause issues, because we start taking the tissue down a road or down a path that it isn't necessarily wired for or designed to handle mechanically. And the reason why I think this gets missed a lot is you can't see a lot of that hidden mechanical dysfunction unless A, you know to look for it, and B, you know what to look for. And I think what this video will hopefully be is that I want to give you guys a roadmap to figure out where your hidden mechanical dysfunction is, that's filtering down, that has set that tissue up to fail when you've been doing basic things. And if you're watching this, you'll probably understand that you developed lateral epicondylitis or tennis elbow from doing something that probably wasn't very heroic. You weren't doing you weren't learning some fancy thing on the piano, or you weren't doing something repetitious in a sense where it was something, overly amazing. A lot of people can get it from work, sitting at a computer, maybe if you're a tiler or a bricklayer, those sorts of things. And instead of your body adapting to that task and just allowing you to get better at that task, you sort of spiraled off that axis and went down the dysfunctional path because something about that wasn't functioning correctly in the first place. It's just very likely that you weren't aware of it. So again, with that being said, I want to show you guys how to find those tissues or those issues with a ball and a foam roller. So what I want to get you guys to do is to grab a ball, a tennis ball, a lacrosse ball, as this is, a baseball, and you can lie down for this. I'll do it sitting up just so that you can see, but we basically want to take the ball and let it press into areas of your neck and the upper back to try and sort of figure out where your stiff, tight areas are, and then test and retest to make sure that you can see the changes that you're making. So I want to structure this like I would in clinic with a patient where, and this is born out of that idea where if someone comes in with tennis elbow and I say, look, there's potentially a neck related cause here, I'm often looked at weirdly, which is completely understandable because it doesn't make sense in a lot of cases. So the best way that I've found to sort of include people in this conversation and highlight those links is that you want to do a movement or an activity that specifically gives you your elbow pain. Then you want to do this test/exercise, reassess that same very movement so you can tell specifically what has changed, because you don't have to guess with this. You don't have to take my word for it. I want to show you how to figure this out for yourself. So what normally works for most people is a simple grip test. So I generally get people to grab my hand and squeeze it as hard as they possibly can. And in most cases, it does reproduce some of that lateral epicondylitis pain. But interestingly as well, it also gives you a good opportunity to assess how strong your grip feels, because clinically grip strength is often affected when the forearm muscles and tendons are affected as they cross the elbow. So you can use something simple as grip strength to give yourself a baseline measurement to retest in a second. Now, if that doesn't hurt you or that doesn't reproduce your symptoms, try picking something up or twisting something. Find something that you know irritates you day to day. Use that as your test retest. Then what I want to get you to do is taking the ball. We want to start sort of at the mid to low neck. So if you start at the base of the neck where the big bump is, place the ball right on that, come up a little bit, then off to the side a little bit. So not all the way out to the side, but literally just roll off that bump. And then again, you can do this lying down. It's much easier to juggle the ball in this scenario. Then all I want you to do is just lean back into the wall or the floor and just get a sense of how it feels to press in here. And you can move the ball around a little bit and go looking for the areas for you that feel a little bit stiff, tight, or tender. Now the exercise isn't rolling. The exercise is finding something that feels stiff and hanging out there until it feels less stiff. And I think the really important thing, and if you've been following the channel before, you'll know how often we use a roller and a ball to try and solve common dysfunction with the spine. The technique is the same, but what I want to get you guys to do is once you've found a spot on, say, the left-hand side for me, and you want to get a sense of how easy that ball sinks in, whether it's tender or tight as well, then roll the ball directly across to the opposite side and repeat the same process, and just get a sense of how it compares to the opposite side or compares to the other side, because it's really important to figure out where the stiffest and the tightest tissue is, not just the most tender. Because mechanically, your body doesn't care whether something's left or right-sided. It just cares about where restrictions are. So if I restrict this part of my shirt, for example, it pulls slack from everywhere around it. And the neck's very similar in that sense, where if you have all of your pain on the left-hand side, maybe you've got some left tennis elbow, but most of your stiffness and tightness feels like it's on the right-hand side, or for the purposes of this, if you feel like the ball doesn't sink in as easy on the right-hand side, but on the left-hand side, it does sink in a lot easier, then you actually need to spend more time on the side that feels restricted, because mechanically, that's where the mechanical dysfunction lies. So for me, I feel a fraction more restricted on the left-hand side. So all I want to do here is just stay here. I just want to let the ball press in for as long as it takes. It could take 30 seconds, it could take a couple of minutes. You can change the angle a little bit depending on what you feel you need, but I want to let the ball press in and allow that tissue to separate, allow the joints underneath to give, because those joints make the gap, the foramen that the nerves come from that associate with the elbow. And one of the things I didn't say earlier is that there's a really strong connection here between the levels that the radial nerve come from and tennis elbow. Because for those anatomy buffs out there, you'll know that the radial nerve comes from the neck, exits under your armpit, down the back of the arm, and it crosses across the outside of the elbow where those tendons become dysfunctional. And what tends to happen is, whether it's neural dysfunction, where you're sort of putting a kink in the nerve and sort of the pressure of that nerve, or the electrical activity of that nerve decreases and affects the tissue that it associates with, whether it's just a neural tension thing where it sort of pulls a lot of slack out of the area, this section of the neck can create a chain reaction of dysfunction that sets this tissue up for dysfunction without us realizing. So what I want you to do is, once you've had enough on one spot, move the ball up a little bit or down a little bit, and just go looking for areas that feel stiff, tight, and tender. And for the purposes of this particular problem, from the middle of your shoulder blade up to the top of your neck, it's most likely going to be at the sort of mid to base of your neck. But if you're also stiff in your upper back, then that's going to make it harder for your neck to function normally. So to be very thorough with this, I want to get you guys to spend some time sort of mid shoulder blade, just systematically work your way up the neck until you run out of things that feel stiff, tight, and tender. And then what's really important here is I need you to retest the exact same movement that you did before. And you don't have to take my word for this, but for me, even just gripping my hand and squeezing, it feels stronger to do just from having done that. Now, I need you guys to experience this for yourselves. So again, you don't have to trust me, but as you start to free up those levels of the neck that associate with your elbow, you should feel like at the very least, your strength starts to change. It should start to get a little bit stronger without ever having done anything to that elbow. Now, depending on where on the spectrum of dysfunction you are for that tennis elbow, if you're right at the beginning and it's not super aggressive, it's not super irritated, it's only been around for a short amount of time, there's every possibility that the soreness and the tenderness associated with that may start to change straight away from doing that neck exercise. If you've been someone who has had this now for a long time, maybe it's really sensitive, really tender, just treating the neck alone may not be enough to get you over the hump mechanically to take the pain out of that area straight away. But at the very least, it should still be enough to see a change in your strength, which is a sign that there's a strong connection there for you guys. So as I said, you still need to do the massage, the strength work, the stretching, all the local stuff to that elbow. But hopefully just by jamming a ball into your neck and upper back, you'll start to see how much of an influence that has on your dysfunction. So obviously I'm aware that to develop a true tendinopathy, there has to be some changes in that tendon. But what I'm finding clinically is even if you don't change that tendon in an instance, it does take time for that to remodel. If you can unglue some of the mechanical dysfunction that may have led to those changes in the first place, that can be enough to get you over that hump and on the road to progress that you just aren't getting normally. So as you keep freeing these areas up and improving them, that mechanical dysfunction can improve and your pain can feel better while you're still working on trying to improve the function of that area. So as I said, please do not take my word for it. Do this and prove it to yourself, and then let me know in the comments below whether you felt a change in your strength, change in the function of that as soon as possible. And remember, we're looking for areas that feel stiff and tight. If it's stiff and tight, but it's not tender, it doesn't matter. We're not looking for pain, we're looking for restrictions. And that restriction can be on either side. So again, if it's here, but your tennis elbow is on this side, that's what needs to go to restore some normal function to here and allow this to function normally. So that's exercise number one. The second exercise is a little bit more locally. And what I find a lot with tennis elbow is, even though the problem is obviously at the elbow, which makes sense, that radial nerve that travels almost up through the triceps and under the armpit, there's a line of dysfunction that we can often have through this area that gets missed. So if you're working really, really hard here to improve the function of this, but there's all this tightness and dysfunction higher up, then again, we're sort of almost pushing it uphill a little bit without restoring normal motion higher to feed some slack back into here. So a really, really simple way to do that with a roll up, and again, go hunting with this, do your test, retest with your grip beforehand, is we can start high up if you want to, so almost on the outside of the arm, so rotated in that externally rotated position. Come down here so you can see, sort of on the outside of that elbow, and then roll up and down. You'll start to find that through that tricep area, there's very likely going to be some tenderness and some tightness in there. And what I want to get you guys to do are two things. So I don't want you to roll up and down like the tendency is, because it doesn't really work in the way that I want it to for this exercise. But what I want to get you to do is, if you find a spot that feels tight, I want you to sort of put a little bit of pressure on it, whatever pressure you feel comfortable with. While you've got some pressure down there, I want you to roll that forearm and that arm away and sort of try and pin it down and then curl it across. Try and peel some of that tightness and tenderness away from the bone, sort of free up some of that fascia, that connective tissue. Try and restore as much normal motion as possible. So as you're rolling, we'll get you to go palm down to really sort of create some more tension and some movement through there. And then you can work your way down the arm, looking for a spot. So for me, that feels a little bit tender. And I'm trying to shear that tissue free, using that rotation, clenched fist or open hand, depending on what works for you. And working your way down sort of that elbow to try and restore as much normal motion to this tissue as possible. And you'll find that as you get closer to that elbow, you'll find a whole bunch of tissue that you didn't realize was really tight and tender. And it's often because we focus down below the elbow through the forearms, but a lot of people don't realize that above the elbow in that sort of that outer side, there's often a lot of tightness and tenderness brought on by that radial nerve. So the first technique is a pressure and a rotation. The second one is pressure and flexion extension. So again, as you sort of bend that elbow, you lengthen those triceps, but we're also trying to unglue some of that tissue as we go. So find a spot that feels tight, take up the slack, bend that tissue to sort of unglue some of that fascia, any of those restrictions, those that neural tightness, try and shear it free through the tissue that it goes through. And again, once you've done that, repeat the same thing again. Recheck your strength, make sure that it feels a little bit better. Now, I should point out too that I use that test as a way to connect the dots for my patients between the neck and the elbow. Sometimes when you do free up that tissue, for some reason, the strength can change from a negative sense. You can feel like there can be a subtle decrease in strength. It still serves an important purpose because it can connect those dots to say that these issues are connected to the neck. Ultimately, we want the ball and the roller to free up any spinal tissue and any neural tissue or connective tissue above the level of the elbow that's restricted, so that we can feed some slack back into that area and give those tissues a chance to settle. And I think that's the missing piece of the puzzle that I really wanted to get across in this video. So I'm hopeful that those two ideas, the neck and the tissue above the elbow, can really help wipe away a lot of the dysfunction that you guys are currently dealing with. Ultimately, this is a conversation about posture, as annoying as that is. If you find that the neck and the upper back are intrinsically linked to your tennis elbow, the only reason, or the main reason I should say, as to why that tissue becomes dysfunctional in the first place often comes from sort of certain neck positions where we're hinging through overloading that tissue over time. And one of the things that I find really interesting about tennis elbow is that we link repetition and overuse as sort of the underlying cause, but I'd actually go as far as to say that you might be using those tissues, but you're also doing it in a position where your neck is in a less than ideal shape. So people that work at a checkout, people who lay bricks, lay tiles, you're working on a computer, the main sort of people that tend to get those tennis elbow symptoms, yes, we're using those tissues a lot, which theoretically should be fine, as I said at the start of the video, but we're also potentially doing it from a position where we're looking down a lot, overloading those neck tissues, pulling some slack out of that, asking those tissues to be potentially dysfunctional, and then using the fingers to bias that tissue and ultimately have a problem. So hopefully that perspective is a really useful one for you guys. Please don't forget about your neck. Let me know again down below what that exercise does for you, whether it hits a piece of the puzzle that you weren't aware of, and maybe hopefully gives you some encouragement that if you keep chiseling away at that dysfunction, it'll lay the foundation for some better days with your tennis elbow and ultimately get you to where you need to be long term, which is not having it anymore and having the confidence to say that if my posture's good, my neck's good, that tennis elbow should not come back again in the future. So obviously there's some nuances either side of that, but that's hopefully enough information for you guys to really make some extra gains in your rehab. So So once again, thank you for joining me. I look forward to hearing back from you guys. And with that being said, I'll see you in the next one.